My name is José Alberto Betances, and I'm a pediatrician at Harvard Vanguard Medical Associates, and I've been practicing medicine since 2005. My family, being immigrants from the Dominican Republic, a lot of my aunts and uncles, as they came into this country, would start living with us. And as a result of that, a lot of my cousins would be coming through our home, and as my brother and I were the only ones who spoke English, we would be the ones who were sort of teaching them English, helping them with schoolwork, and then essentially became discipline and advice and counseling. And so I had this affinity for working with young people from a very early age that came from essentially raising my cousins, and that led me quite nicely into a career in pediatrics. I feel that the job and the role of the physician is to really be a part of the family. So I often think of myself as not a pediatrician who works in this community, but a member of this community who happens to be a pediatrician. And that makes it just a little bit different. So we're all sort of in this together. We're all trying to help our families grow and be healthy members of our communities, and I like to just be a part of that with everybody else. So I think on the first visit, typically set the stage for the families, right? I like to just make sure they understand that that I'm there to help them, and ask them to make sure that I cover everything that they might be worried about, to tell me what they are worried about first. And I try to keep it very laid back and very casual and friendly towards the kids, because I think while the focus is on having a conversation with the parent, I think it's very important to bring in the child's point of view as well. And so depending on their age, I always have some questions that I like to ask the child as well, to make sure they're included in the conversation.